welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you for joining us.
Well, thank you very much for having me on your program.
Yes, sir. Yesterday you addressed long COVID, and today I just wanted to ask you again in terms of the effects of persons with specific medical complaints. And then I heard a study where women were also susceptible to this long COVID, probably more than men. Could you explain?
Well, long COVID occurs, as we discussed before, after somebody would have been non-infectious and being discharged from the hospital. Or in some cases, if they had a milder form of the disease, they would have gone through that duration, and then maybe 2 to 3 months after, they would have had other signs and symptoms. Now, during the period of long COVID, the person is not infectious, but the damage that was done during the infection to different organs in the body, that's the effect that they're feeling weeks and months after. So our knowledge of this is not very clear. Now a lot of the doctors and clinicians and so, as they're following up patients, they're now discovering this. And the manifestations of long COVID takes various forms depending on which organ of the body was affected. So in some persons you are seeing if their brain has been affected, then they might have disruption of sleep, they might have other different signs and symptoms that affects the brain. We have seen in patients where their heart has been affected. So in some cases the heart muscle is affected, and those persons later on can exhibit signs and symptoms of a heart attack, or what we call medically a myocardial infarction. In other cases with the heart, the beat of the heart is disrupted. So you have irregular heartbeat, and that too can create a problem for persons, because if the heart does not beat properly, it means the pumping capacity of the heart is affected, and therefore those persons can develop other complications. So these are things that we're seeing. You have brain problems, you have heart problems, persons who have where the virus might have affected the kidney. They're seeing different signs and symptoms in the kidney, in the gastrointestinal system. Some people are affected there as well, in the liver. So multiple organs of the body can be affected by COVID. I know when we first started out, we were telling people that it was more a respiratory virus, and most COVID viruses are respiratory virus, that they affect the respiratory system. But this particular COVID virus, the SARS-CoV-2, affects not only the respiratory system, but multiple organs in the body. And because of that, when you are recovering after the infection, some people are still seeing lingering signs that would continue to affect them for weeks or months. Now, we don't have clear information on the prevalence of how many people are affected after the infection, how widespread is this, and those are things now that countries are trying to start gather. So we'll learn more as we go, and maybe in the next few months we'll get much more information. Treatment strategies, how to deal with this, is still a work in progress, and therefore, again, as the clinicians and scientists study this some more, then we'll get more information which we'll then share with the public.
Talking about more information, coming out of this period, whenever that happens, would there be a possibility of changes or improvements in guidelines in how hospitals and health facilities operate generally?
Certainly, because the science of COVID has been changing almost on a weekly basis. You will find that one drug or one medicine that was previously considered to have an effect on the virus. When it's used in the real setting on patients, maybe it might not be as effective. So what we have right now, there's no specific medication to treat COVID-19. And I want people to understand that. There's no specific medication. What we have is existing medication that was used, say, in the lab and found to have maybe some activity against this virus. And then we're using that now in patients. So when you start using it in patients, the same effect that you probably have in the lab, you don't get the same effect maybe in patients. And that is why sometimes the guidelines would have to change. Now, right now, we have medicines that we are looking at how to maybe interfere with the life cycle of the virus so as to reduce, if the virus replicates in a certain way, if we disrupt this life cycle, then we will be able to protect people. So there are a number of medication that was used in other diseases such as HIV. Those medications are called antiretroviral medicines. And we have been repurposing some of those to use it in HIV patients to disrupt their life. Well, we have used it in HIV patient and it has worked well there. And some of these have been repurposed to use in COVID-19 patients. And the same mechanism, trying to disrupt the viral cycle. So that's one group of medication that we've been using. The second group has to do with the immune system of the body. And when our body reacts to a virus, there are various things that the body would do. One, it produces antibody. Secondly, it produces a number of other chemicals that would react against the invading organism. And sometimes we need to modulate the effects of those chemicals, and there are different classes of medicines that are now being used to help to modulate this effect that we can have. The body's reaction to viruses generally are good, but what we have seen in some patients that have COVID, that the body immune system can overreact. And that is what has been referred to in a lot of the articles and so as a cytokine storm. And because of that overreaction, some people might get COVID in a more severe way. And therefore, to help to modulate that effect of the cytokine storm, there are certain medication that can be given. Now, all this is a work in progress, and therefore, 1 month ago, the guidelines might have said A, B, and C medication. But because the science is constantly changing and new results, new clinical trials are coming out to measure the efficacy and the safety of these medication, that these guidelines are changing. So we ourselves, we are looking at what is happening globally. We follow all the major organizations that would issue guidelines. And then we use that as the basis to construct our own guidelines based on the scientific evidence that is currently available by the World Health Organization and by some of the other global organizations that look at efficacy of medicines. We have in place in Guyana a scientific, I would say a clinical scientific committee that has constantly been reviewing our guidelines. And by the end of the week, we are going to update ours as well.
Minister, let's talk about our regions. How are we faring? I know there was a spike a few weeks ago in Region 1. What is happening in terms of the region and the recovery rate specifically?
Well, when you look at our numbers nationally, you would see that it shows a trend that it's going up, right? In some cases, over the last week, it's not going up as fast, and so that curve is not very steep. So we have seen that the curve is probably getting a little bit less. That, however, is one thing. But when you disaggregate the numbers and you look at the regions, then we see a totally different picture. So let's take Region 9. 2 to 3 weeks ago, we had a spike. So you would have seen a steep curve because the numbers were going up. But because of the measures that we took in Region 9, currently we only have 6 active cases. So when you look at regional distribution of cases, you would see that some of them are doing quite well, very few cases, very few active cases, and based on the active cases, we would revise the guidelines accordingly. Region 1 initially had a number of cases. Then in the Moruca end, you had a spike. And then you would recall that there was a lockdown, and then eventually that number went down. Now what we are seeing in Region 1 is at the other end, in the Mabaruma end, we are seeing a lot more cases. And again, we are managing to look at the villages where we are seeing spikes. So like, for example, we have seen a spike in Guyana, and we have established a team that went into the community, that worked with the local leadership there to talk to them, to explain to them how this virus is being spread, what precautionary measures they can take, what public health measures they need to take. And with the community's compliance, we have put these things in place. Plus, we have localized a curfew for certain communities in the region, all in an effort to reduce the spread to neighboring communities. So this is an ongoing effort, and I'm sure that after a week or two, we'll see the dynamic changing again.
Right. Minister, I know that the ventilators are going out to the different regions. What about other supports? Are they in terms of personnel and so on?
So again, what we do, we have a core set of personnel in every region. So they're there, they've been trained to deal with COVID and all of that, and they can work collaboratively, not just to do the clinical part of it, but also to look at how you do contact tracing, how you look at environmental sanitation, and a whole host of other things. So we have a team of people who would work together to be able to manage the disease in the region. So we have what you might call a medical task force in the region that does this management. Above that medical task force, you have a regional task force on COVID that incorporates the governmental agency in the region and the medical people in the region. That too, they have been doing more than the medical response at the regional level, so they do help with educational response. They look at some socioeconomic relief for the people living in the region, and a whole host of other things that we need to do to curtail the virus. So that has been an ongoing exercise. In terms of equipment at the hospitals themselves, we have identified in each hospital a section where we can have X amount of beds. These beds would have been isolated from the rest of the hospital. We have put in special triage procedures in place so that people who are infected would come through this triage system and it doesn't disrupt the other functions of the hospital. And if you're hospitalized there, then there are a number of other regulations that come into being. If you're, say, severely sick or critically ill, then you require ventilation support. And to do that, we are now trying to equip every regional hospital with ventilators. So we have enough ventilators. Now we are trying to get them out to the regions, have them set up. We have had some preliminary training for the doctors, but now that they have the equipment, we will also run some practical training on the equipment. So if a patient comes in and they need that type of support, they will be able to get it. In addition to that, these machines would require that they have oxygen, and we have also acquired a number of oxygen concentrators. So this, you don't have to go buy a cylinder of oxygen. What this machine does, it is take ordinary air and removes the nitrogen from the air, so that what comes out at the other end is a concentrated source of oxygen. And we have been twinning the ventilators with these oxygen concentrators, because in the hinterland regions, it is a challenge to be able to acquire oxygen on a regular basis. So this is going to help us a great deal, and we are deploying these to all our regional hospitals. So in terms of equipment, we are trying to get that out there to them. We have on order an antigen test. So this is not the RT-PCR tests that we take samples and bring them to the lab. This antigen test is one where right at the site where you're seeing the patient, if you suspect them to have COVID, you can run the test there, and within 45 minutes you'll get back the results. So we have placed an order for 20,000 such tests, and hopefully by sometime in November we will be able to get those tests, and once we get them, the idea is to deploy them to the interior areas because of the challenge in getting test results to them and getting tests done quickly. So once we get them, our idea is that we'll deploy them, and I think that would improve the testing capacity in those regions.
All right, and I also know that in Region 4 itself, our testing capacity increased just weeks ago with that machine that we've gotten.
Right, so we actually, we feel now that we would be able to easily go up to about 600 tests per day. Once we get the samples to run, we can easily do that. And with some additional machines that we will be soon putting on stream, we think we can even take that capacity up even higher. So we will probably be able very shortly to do about 1,000 tests per day. But we are working on it. So one of the things, you know, that in addition to the Georgetown Public Hospital where we will take samples, we have had a facility at Horstelling and one at Paradise. And we have been getting a lot of people who would come to us. So we will extend those services. And our priority had always been that we would look at frontline health workers who show up and wanted a test. We look at hospitalized patients because they must be given priority. Then persons with signs and symptoms of COVID. So we have a hierarchy of priorities, the people who would get thing. So in that hierarchy, persons who are asymptomatic would kind of be on the bottom of the list. But we know that asymptomatic people are also important because they can be positive and they don't know. So we want to make sure that asymptomatics who come to our testing sites are able to get that test as well. Now, many of the other regions have not really established testing centers, and that's one of the things that we are exploring now, to establish new testing centers and allow people who want to get the test to come and get the test. So we'll see how that goes. In the next maybe week or two, we'll start thinking about adding some fixed sites in different regions, and we'll see whether people would come to those sites. In addition to that, one of the things that we are looking at, wherever we see spikes, especially in these coastal regions, we would want to maybe have a mobile team deployed to those communities. So apart from talking to people about how to protect themselves and the public health measures they need to embrace, in that mobile team we want to offer PCR testing as well. So that's something that we are also going to work on.
All right. Minister, as we wrap up, I wanted you to address the fact that more social events are seemingly taking place, especially in Georgetown, and persons, I don't want to say not adhering, but are a bit more relaxed now.
Well, a couple of things there. Um, some social events might be permissible, but they would have to follow strict guidelines. There are many people who are planning social events, but they have not consulted with the authorities for these social events. So they haven't consulted with the police, they haven't consulted with the COVID task force or secretariat, and therefore, if we identify those events and they don't get permission, then the enforcement agencies would shut them down. So rather than have unpleasantness, it is to comply with the rules. There's a reason why we have rules, and people need to comply with those rules. One of the things that we have been very strong against is to have bars open or to have events where people are going to drink. And there's a rationale for that. One, when people, first of all, to drink, you have to remove your mask, and then they're in close proximity with each other. That's where you can easily get spread. And then let's assume as people drink and they get drunk, then they don't abide by any of the protocols. So, this is very challenging. And around the world, this is what people have been prohibiting. I don't know why it is that people feel that somehow we should allow these things when we know that this is one of the ways in which the virus can be spread. So people have to bear with us. We are in a serious situation. People are getting sick. Some people require hospitalization. Some people require ICU care. Some people die, right, because they get the most severe or critical forms of COVID. So it's a serious disease. And then even those who recover, some of them are getting the long forms of COVID. So we have to treat this thing with seriousness. I think there are a lot of young people who believe maybe that this is not going to affect me. Well, at one time we were advising them, and we still do, that you have to take precautions because you might go home to your elderly parents or grandparents and you can infect them. That is still there. But now what the science is showing is that young people can get the milder form of the disease and then they end up with long COVID. Right? So that becomes a problem. And, then they can get a more fatal illness. So we have to all take precautions. We have to all work together. Once we get a vaccine and we start immunizing people and so forth, we are going to exit COVID. Then we can go back to some of those things that we want to enjoy. But as of now, we have to take these precautions because we don't have the tools right now to help us to exit COVID. Those tools would be coming, but we don't have them right now. And we are making, as a government, we are making all efforts to get those tools and to make them available. But nowhere in the world is there an effective vaccine as yet. Those things are still being worked upon. And until we get that, then I think everybody would have to take the precautions that we have been telling them to take.
All right, Minister Anthony, thank you so much.
Thank you.
Well, that's it for today's COVID-19 update. Remember, for more information, you can log on to our website, dpi.gov.gy, or the Ministry of Health's website, health.gov.gy, and our social media platforms as well. Thank you.